Welcome everyone. So this is our taster lecture for our Health Informatics taught Masters programme here at Swansea University. Thank you so much for taking the time to either join us live or to watch this as a recording. The session is being recorded. We will share the recording with you after the session's finished. So don't worry if you think of questions after the session's finished or if you haven't been able to join us live. Welcome, my name is Bethany. I'm the International Officer for the Faculty of Medicine, Health and Life Science here at Swansea University, and I'm very pleased today to be joined by Alex Paget Rodrigues, who is one of our academics on our Health Informatics programme. So we're hoping that today will give you just a bit more of an insight into the topic. We know that it's such a hugely fast-growing area in the world these days. So Alex is going to share some more information about the topic with us, and that might interest you sort of in asking some questions, either about the subject or about the programme we have specifically here at Swansea University. So I'm going to hand over now to Alex.
Oh, thanks, Bethany. Hi, and good afternoon, everybody, as it is here now. So my name's Alex Paget Rodrigues, and I'm a lecturer in the Health Informatics programme. What I'm going to do is share my screen with you because I have got some slides. I'm hoping that we don't need to rely on these too much. Maybe you'll have some questions, but they'll guide us through some of the key parts of the topic. Is that coming through okay, that slide? Excellent, thank you very much. So health informatics is what we're going to discuss, and I've put in there digital health as well. The reason for that is over time, what we're going to see probably is our topic being more defined as digital health. So it's both to help us understand the topic and what it does, so much as it is the development as time goes by. So you may see it referred to as health informatics or indeed as digital health. So what I plan to do is give some slides and give a few definitions today. I hope just to give a sort of overview of what the content is like, definitions, the roles that you can undertake having completed a taught masters in health informatics, how it's applied out there in the healthcare industry. I'm hoping to illustrate the structure of the course, a very typical structure, not all of the details, and look at some of the employment pathways out there as well. That is obviously the important outcome at the end of it for some people. So this is a very, very wordy definition. I'm not going to go through this verbatim, but this is from the British Medical Association. So I'm just going to pick out a few key phrases here. So health informatics is now tending to replace the previously common term medical informatics, which reflects the sort of multidisciplinary nature of the topic. It isn't a medical topic as such. It applies to a range of healthcare professionals and allied healthcare professionals. It recognises the role of citizens as agents in their own care, which is an interesting phrase. So the idea is that we're going to put the patient at the centre of their healthcare, handing over a little bit more control, which quite possibly traditionally has not been the case in healthcare in general. Healthcare has been something we've always kept quite closely guarded traditionally. But health informatics is about following the trend, which is that patients having greater access and greater control over their health decisions to be able to make better lifestyle choices as well. So health informatics is thus an essential and pervasive element in healthcare activity. It's pivotal to healthcare in the modern healthcare environment. It includes a worldwide scientific community engaged in advancing teaching and teaching knowledge of the application of the information. So what we'll look at a bit later on is one of the major roles of a health informatician as such would be to educate colleagues, would be to increase knowledge base for patients. So some of it is about education and training for others. So in summary, the application of information and communication technologies to healthcare is what health informatics is all about. We've got a definition here as well, which is from one of the seminal texts that we refer to throughout the course by Mae'r. There will be a reference list at the end if anyone would like to see it. So health informatics is the logic of healthcare. That's what we're talking about, is the logic. It's the study of how clinical knowledge is created, shaped, shared, and applied. So it isn't just about the systems, it is about the patient and the information and how far that gets and getting to the right people in the right time. It also ultimately is a study of how we organize ourselves, that refers to patients and professionals, to create and run healthcare organizations. So when I say healthcare organizations, I'm going to refer a lot to sort of NHS planning in this session, purely because the NHS sort of guides the industry in the UK in terms of healthcare and its development. It's not to say that it is exclusively the only provider of healthcare, but when you've got independent sectors involved in all parts of healthcare, the lead is taken from the NHS initiatives and strategies. So we will have a look at some of those, why they're important, how they're relevant to health informatics. So the role then of the healthcare professional, the healthcare practitioner in the 21st century. We are there to support the delivery of effective healthcare. You might have heard the expression of prudent healthcare delivery. So that is the right care delivered in the right way, effectively. To ensure professional standards of clinical excellence are met. So some of you guys might be registered professionals already. If you don't, you may have formal healthcare experience. However, all of us are accountable in some way to some organization or other. For nurses, it will be the NMC in the UK, for midwives as well. For doctors, it would be the General Medical Council. For physios and such and associated professionals, it would be the HCPC, and so on. There are lots and lots of registered bodies. We've also got the governance in our organizations, the strategies and things that tell us what we need to do. All of these things are consistent, is that we should be meeting a certain set of standards, and that those standards include us being a holistic practitioner that include informatics skills. So it doesn't matter which profession you're in, which part of the healthcare sector you're involved in, what your background is. We've all got an emphasis on being able to competently implement informatics skills, or to be able to help our colleagues and raise awareness and education to do so. So part of our role will be able to meet those challenges, and one way to do that is to study this specific topic. So health informatics, where will you see it? Number one, top of the list, has got to be electronic health records, and we do cover quite a large part of the course thinking about this. This is not a new topic. Certainly from my experience and my background, I didn't explain, my background is in mental health nursing originally. We've had electronic health records for decades, but they have evolved significantly. They've evolved from being a sort of base set of data information on the screen into being the primary covering documentation for each of our patient cases, all of our interactions. They can include a lot of clinical information, such as blood results, test results. They'll include conversations, they'll include telephone contacts, and increasingly they will involve a certain level of access to the patient. Telemedicine, again, isn't a new area, but is developing as quickly as electronic health records. Being able to remotely sort of deliver interventions to individuals is not a brand new concept, but it is a hugely recently growing concept. To be able to deliver, for example, counseling or psychological interventions from a remote location has meant greater access for individuals. It's also meant greater complications. It's also meant there needs to be greater thought and study around the idea of telemedicine. It has grown rapidly, not to mention, of course, the more recent pandemic, which had its role in increasing the role of telemedicine. Telemetry then is the remote monitoring, of course, of certain health measures. These could be cardiac or otherwise. The interoperability of these things is becoming much more relevant and much more important. Being able to transmit a set of results from one place to another is a simple task. Being able to have them in the right place at the right time for someone to interpret them is the skill of a health informatician. E-commerce then, I suppose, would be less likely to have been seen in the NHS services that we're thinking about sometimes. However, e-commerce has a huge role as part of the health service, as part of the wider sector, especially in the independent and private sectors. Prescription services then. You probably all had some experience of using your informatics skills already in prescription services. This is an area which is under development, particularly in Wales, where we think a lot about our sort of Wales policies. That's where we're based. There is a new development in terms of an NHS Wales app. There's been an ability to request electronic prescriptions for a long time, but this has been merged into a new overarching app, which will include patient information. It's in early stages of development, sadly. There's a variable level in, I would say, competency and literacy when it comes to the use of the app. Not only that, but there's also a huge variation in the willingness of organizations sharing information and how much information they do share. So this is an interesting area for us. Clinical coding then is an area which we do look at in one of our modules as well. We would refer to the International Classification of Diseases. So that's the World Health Organization's way of labeling diagnoses with a clinical coding. We look at the relevance of that clinical coding and how it can be used inside our systems of working in information communication technology in the world of health informatics. And ultimately evidence-based. The literature is clear, and we will be looking at a lot of the literature. You'll need to be thinking about how you write your assignments and everything. It's all based on the latest evidence, because as practitioners, we need to be using the latest evidence-based information for our interventions. So as already mentioned, health informatics is a multidisciplinary field, okay? It encompasses a lot of professions because it needs to bring us all together and get us talking to each other in a more efficient and helpful way. So I've got a couple of studies here, and a qualitative study on the use of ICT systems in multidisciplinary teams in the coordination of healthcare by Janssen et al. Found that real-time data collection and imaging may improve patient-centered care coordination. So what we're saying is that the ability to adequately share information, the most pertinent information in the pertinent amount of time between professionals, increases the ability for the care to be coordinated. If the care is coordinated, we can ensure that the correct care is delivered in the correct way to the correct person. There was also an EU-wide study of MDT meetings, MTMs, and the application of ICT systems. Now, this evidence is quite strong, and it says the emergence of an MTM model that is better integrated, so the use of integration and interoperability in the wider health system context, and incorporates inputs from patients and support systems, make traditional meetings more dynamic and interconnected. So that's saying two things, and there's a couple of themes in there that we're going to be looking at in health informatics. One, the connectedness of systems, the ability of professionals to talk to each other, and massively the role of the patient in organizing that. So they all have one thing in common, which is in order to be able to practice effectively, a practitioner in today's healthcare services, healthcare sector, must be competent in the use of ICTs, information communication technologies. More importantly, they need to understand the rationale behind their use. So why are informatics skills needed? So this is from an NHS Wales policy document which guides the health service in our locality. However, it says investment in IT will enhance your role as a practitioner in the future. Access to patients' records and test results, the ability to order drugs and tests without filling in endless pieces of paper. The information and knowledge about best practices will be at your fingertips. We're hoping it makes things easier, simpler. Properly trained to use the new systems, you should find that you're spending less time in front of technology and more time where you need to be, which is with your patients. These new skills will be an important part of your professional and personal development. Again, just highlighting that it's a core skill. It's one that lends itself to all professions. So we're going to think a little bit for a moment about what some of the strategies are, right? So that's some of the topics that we're thinking about in health informatics, but why? What are the strategies that's driving that? So I guess it's reassuring to see that there are a lot of different sets of guidance out there which are emphasising the need for us to expand our influence in health informatics. One, it's fairly dated now, but it still stands as a UK strategy on the workforce empowerment will involve significant changes, developing skills, and it's likely to become more central to clinical culture, consultations with patients. So there's a drive really in changing the way we work to include the patient and for us to link up a little bit better. Most recently then, the plan for digital health and social care is a UK strategy from the UK government. And the plan is to have health and social care set out a vision for a digitally enabled health and social care system. So just to even to widen it a little further, the strategy now is looking at the wider health and social care system. So that would include social workers and community teams, but also things like care homes and residential homes that are outliers traditionally in the community that aren't as linked up. There's excellent work starting now to increase availability of information for these areas, especially in social care. You can imagine the huge population that are in looked after in these sorts of areas. They're virtually cut off from the systems of communication and information technology as soon as they're admitted into these places, because the access isn't there. The thinking is changing around that, so there's a lot of investment in the idea of increasing access to the right people, and the right people are the people looking after the patients. Two strategies for Wales. These are very Wales-centric, however, they're very relevant to us. There's one in 2015, Informed Health and Care, a digital health and social care strategy for Wales, further updated in 2023 with a very similar name. And what this did was this. It's a lot of information, but it was these key 4 principles on the list, on the left, which are that the principle is that the information will be for you. Yeah, that the patients will be given the opportunity to be more involved in their healthcare by increasing their access to their information. The evidence is very strong that if you increase the patient's access to information, if you increase their ability to have some more control over their healthcare, it improves their health outcomes. The evidence is strong and the evidence is still building. If you involve a person, they will have a greater outcome. The other part of the vision is to support professionals so that we're talking to each other a little better. I can tell you from experience in the mental health care sector that the variety of systems of working, the variety of policies and governance and different teams involved in the delivery of healthcare varies greatly geographically. The trouble is our patients don't stay in one place, they do move around. So that need for interoperability of systems has always been there. And I think now there's a recognition that that started to happen with the Once for Wales platform. We're looking at trying to sort of centralize a lot of these systems and bring them under one umbrella. It's not an easy task. They also talk about improvement in innovation. So this would be to improve decision making using better use of making better use of data. And they also want to look at a planned future. And just some of the interesting stats on the right. Now, bear in mind, these are a little older now. These are from 2015. But in 2015 in Wales, 86% of households did have internet access, which was increased by 6% from 2014. So you can imagine now, I'm going to say it's probably a lot higher proportion of households who do have access. Then at the bottom right there, only 37% of internet users in Wales use the internet to find health information. I'm sure that will have changed. There's a big drive towards, I suppose, self-care. When it comes to health promotion, we're making people aware a lot more about what improves and what doesn't. And we're pushing people a lot more to internet resources. I mentioned psychological interventions. A lot of therapies are delivered online. And not only that, but some of these interventions are actually delivered without the use of a person one-to-one. They're actually web driven, so there's going to be interesting developments there. So there was 3 aims in this strategy. One is to transform digital skills and partnerships. This is the strategy that talks about the need to increase awareness, to increase training and education, to increase people's skills and competency with IT systems. It's a rapidly evolving world, and it involves a lot of changes a lot of the time. People need to have the opportunity to be trained and educated. Part of the role of a health informatician is going to be doing that, not just implementing or managing systems, but helping people use them. The system is only as good as the input that it gets from the user. So that strategy is going to be focusing on that. The second aim is going to be look at building new platforms. I already mentioned they're trying to think about ways of merging systems so that we're not working in silos, so that we can have greater communication between us, that the information gets to the right people at the right time. This has always been a barrier. Being able to access information, particularly in geographical differences, has always been a barrier to achieving healthcare outcomes and increasing risk. And aim 3 is to make services digital first. So as services develop now, they're going to be making sure that there is a digital component. This is digital health thinking at its best. All new developments need to be thought about in the context of how we access them digitally, how the patient accesses them digitally, where the information goes and how it's used. So those are some of the strategies, really. But who is the benefit? Who does the benefit come to? Well, I think the first answer would be the patient. If we can increase the efficiency of healthcare, how practitioners, clinicians, administrators, planners, and analysts all talk to each other, the only person that should be benefiting at the end of this is the patient. So while it'll make our job easier, hopefully the aim for that is to get the standard of care up to a level that gives patients a better health outcome. So we're going to be looking a lot around the developments in patient access to information and patient control, and we're going to be looking a lot about information sharing. So ICT technologies are to achieve a health gain. Now, the means to an end, not an end itself. So if the technology we're using becomes more of a topic than the healthcare diagnoses we're aiming to help with, then it's not useful. It's about improving existing processes and making them more effective, developing new processes and ways of working around these technologies to increase efficiency and use less time. Also, having information to hand when needed. I can certainly tell you from working with patients that time is a key factor. It's one of the major factors in risk management. And you manage the risk of anything, whether it be mental, physical, anything kind of health related. It needs to be available at a timely manner, appropriate information to the circumstances, so that we're not able to access it, in non-useful information. There's a balance to be struck between the safety of information and the opening of access to it, which is a huge, obviously, topic of debate, which is interesting and ongoing. It must be accurate, up to date, in the correct format, i.e. easy to understand. So in the future, then, the trends, I think, are fairly obvious to all of us. The role of artificial intelligence is growing, not just from generative text, but from the role of being able to predict and manage conditions. It's already being tested. There is evidence out there to suggest it's being used in different roles in healthcare to be able to take information, correct information, pertinent information, and come up with algorithms which predict certain conditions. Interesting and somewhat moving in some ways. Precision medicine then is obviously going to be focusing on the use of technology to make sure that the healthcare is better targeted. Healthcare in any context is a finite resource. There are only so many people, there is only so much of a budget. Being able to correctly direct that is critical. There's also a theme in wearable health devices, which I guess is already happening. Those of you who've got an Apple iWatch, I don't, or a Fitbit or anything like that, that's collecting information about your I gather, a colleague of mine showed me that it can take an ECG without taking it anywhere. It actually takes a very simplistic ECG from a wristwatch, which stores into your phone. Now, how useful is that information? And, where's the interoperability going to be relevant there? Well, wouldn't it be wonderful if an ECG could pop up on my GP screen every time there was a change in a sinus rhythm? It could it could increase the chance of preventable disease being managed. Historically, then, the NHS has not used or developed an IT strategic asset in delivering and managing healthcare. We're catching up here in the UK with the NHS. It is now a priority, you can see from the strategies, but this gives us a perspective into sort of where we've been. There has been a lot of resistance in the past, so our job as informaticians is to educate, promote, and show the benefits as well as the risks of implementing new systems of working. Moving swiftly on then, so this is from our course catalogue. So this is what our course specifically aims to do, which is analyze the development of the profession of health informatics. Okay, so there's an element of critical analysis in the first module around some of the evidence, where you're asked to find the evidence and think about why it supports or doesn't support the idea of the role of informatics. Evaluate communication systems and health records in healthcare is an area of interest of mine. I think it's a very important area. Critically analyze data quality and management, including secondary uses of clinical data. So it's secondary data that we're thinking about. Evaluate information systems and technology in healthcare is one of the things that we're hoping to do. Define and analyze knowledge management in healthcare. And finally, critically evaluate literature and research reports in order to apply evidence-based practice in health informatics. And we do that through a lot of other work as well. Here is a typical layout of the modules. Okay, so you've got the 7 modules there and how they run. This particular version is for a September cohort, but obviously there's a variation for January. So there's 6 taught modules plus the dissertation, and each of those modules are of 20 credits. And those are the titles of the modules. The assessments are variable, I will say. The way we assess things, we like to be making sure that we challenge people, but also that our assessments are fit for purpose. So I'm not going to talk a lot about what each of the assignments might be, because they're going to change. They are a dynamic thing, but we're trying to make sure that they remain interesting and relevant. Finally, then, we're going to just have a look at some of the examples, and we've touched on a few already, of the sort of roles and career pathways that you can find out there for health informatics or digital health. So the first one, and this is from NHS careers, so these are fairly generic, okay? If you were to go and look at job opportunities specifically, you would find quite a lot of different titles, especially in NHS jobs. But a clinical informatics practitioner, then, you'll be capturing, communicating, and using data and clinical knowledge to support health professionals. Okay, so that could include the development of digital tools, apps, software to support the correct method of getting the right information to the right people at the right time. Educational training, I've already mentioned. There's a huge, huge role for us as the people who know about these systems to increase awareness, confidence and competence with the healthcare practitioners, because without them being on board, the systems can't capture the right information. It does require the practitioners to be up to date. Health records and patient admin, you could have a role there, or information and communications technology, IT departments, yeah, including email systems, mobile communications. You could be involved in information management, the analysis and interpretation of health data. You could be involved in knowledge and library services. And most interestingly for me, I think, project and program management. You could be involved in the creation of a new system and the delivery of a project to establish a new way of working, to use data appropriately, improving the way that information gets across organizations from practitioner to practitioner, or from patients to patient and patient practitioner. And that's kind of it, really. So I'm open to any questions. Bethany, I'll hand back over to you for a moment.
Thank you so much, Alex. I mean, you can see really why health informatics is just such a hugely fast-growing area, because it's just got so many applications. So please do all of you who are perhaps watching this live, please do use the Q&A function at the bottom of your screens if you have any questions that you would like to ask, either about the subject or about the programme that we have at Swansea University. I know that I've got a couple of questions that were sort of pre-sent to me, so we'll pass those over to Alex. But please do, in the meantime, think of if there's anything that you would like to ask whilst we have Alex live with us. Please do use the Q&A function at the bottom of your screen, and we will get to those. So, I mean, one of the first sort of questions is in terms of the subject is, I don't, in my mind, perhaps COVID has potentially played quite a large role in the advancement of health informatics. I mean, would you say that was a fair assumption? And if so, like how do you think that has helped the advancement?
Yeah, absolutely. I would say that's a very fair assumption. I mean, it's the evidence is there's been a lot of research done already. You wouldn't have to look very, very far to find the evidence. There's been a surge in remote working. There's been a surge in the application of telemedicine. I mentioned like the example of psychological interventions, just because that's an area of interest of mine. There has been an explosion. It's not without its pros and cons. And I guess that's where we come in. We're going to be looking at the evidence to critically analyze it. You know, is the delivery of remote therapy, is that the answer? Well, there's plenty of evidence to suggest it increases access, it increases people's attendance because they don't have the awkwardness of the interpersonal relationships. But the downside is it doesn't have the same level of efficacy as a person looking directly at you with eye contact. So yeah, we've got a big role in sort of unpicking a lot of this, I think, and coming up with some critical analysis, which gives us the pros and cons. But it has been a huge change, which makes the subject even more relevant, I guess.
Fantastic. And I know that one question that I certainly get when I speak with students who are perhaps considering health informatics is, you know, what is the difference between health informatics and health data science? You know, like in my mind, it's quite easy to sort of think they are similar, but I know that there is quite a big difference. So perhaps you could just expand on that a little bit, Alex.
Yeah, so when we're thinking about health informatics, we're looking at the systems that I've talked about. We're looking at the sort of level of delivery. We're looking at the interoperability between areas of the health services and health deliverers, health providers that we're looking at. Health data science, I suppose, and I'd have to defer to my colleagues who are an expert on this, but would be looking more about the use of the data in those systems. So looking at the analysis, the analytics and the processing of that data and the interpretation of that data and what it means, what that specific data means to a practitioner. So there's a subtle difference, but I would always think of it as we're looking at the systems of interoperability. We're looking at the top end, whereas the data analysts are your health data science.
Great. And I suppose partly in my mind, the health data science is perhaps more aimed at those individuals who are wanting to do that sort of level of kind of back-end work, if you like, more IT centered. So perhaps programming, coding, things like that. And health informatics doesn't necessarily require that knowledge. Is that also fair to say?
I would say, yeah, that's my understanding. And again, I would have to defer to my expert colleagues. However, yeah, if you're looking at the sort of programming and coding side of things related to health data, then health data science is definitely more relevant. Whereas the health informatics side is the sort of human side in a way, where we're looking at the systems of working at the front end.
Great, thank you for that, Alex. So I can see a question that's come through around sort of internships within the NHS or elsewhere. So I do know that there aren't any kind of internships integral as part of the health informatics program that we have here at Swansea. One thing I would like to say, just perhaps before I pass over to Alex, who's perhaps got some more insight into this, but I do know that at Swansea University, we have got a fantastic Swansea Employability Academy, as well as a faculty employability team. And both of those teams are free to access. Students can access them, you know, and their resources, their support throughout their time at university, but also long after the point that they graduate. So a lot of our students, you know, find that useful because both of those departments, both those resources are able to support students in identifying, you know, perhaps potential benefits beneficial roles for them once they graduate, or either part-time roles whilst they're studying. But that is sort of an option beyond the program. But perhaps you have anything to add to that, Alex?
Yeah, I suppose that, I mean, just to say that given that we're a full-time program, if indeed you go down that pathway, there isn't that much room, I suppose, for additional work experience during the course. But just to reiterate what Bethany mentioned about the dedicated teams we've got out there, employability-wise, there's a lot of help out there for you once you get through it. So yeah, to answer that, there's no sort of link directly into an internship, as you mentioned, but just to reiterate what Bethany said, that's really helpful.
Thank you. So please do keep your questions coming in. Use the Q&A function at the bottom of your screen. I know that our sort of session was initially scheduled for an hour, but obviously if there aren't any questions, then we can perhaps end the session a bit shorter than that. But I'm going to leave it open for a couple more moments just to allow anyone, perhaps you might think of something, or definitely if there are any questions that you think of after the session has ended, or if you haven't been able to join us live and you'd like to answer some questions, then what I'm going to do is I'm just going to share my screen with you. Hopefully this will work, just so you can make a note of our central email address. So if you do have any questions following this, you can email studyfmhls@swansea.ac.uk, and whether that is something to do with our health informatics program in particular, or about perhaps the application process. We are still open for and welcoming applications for September 2024 for our programs, including health informatics. So hopefully that taste lecture has kind of ignited your interest, and you can see how many different applications, how many different areas you have the potential to go into once you get to that sort of stage of graduation from the program. I think the possibilities are almost endless. It sounds really exciting, Alex.
Yeah, it is an exciting and growing in relevance field. So I'd recommend getting in touch. And there's been a question I can see about whether there's any important sort of reading. I can answer any technical knowledge we need to have, or any courses or material. I can recommend some reading, certainly. There's no need for any technical knowledge, but I do believe that we're looking for some experience in healthcare. However, this text I put in the answers box there is one that we refer to frequently in the course. If you're interested, I'd recommend it.
And just to add to that as well, if you are interested in this topic, whether you're interested in our program specifically or just interested in the topic, then something that you all can access is if you go onto the Health Informatics web page on Swansea University, then you'll be able to see all of the modules that are part of the program, and you can actually go into each individual module, and that gives you all the information that you'd need to know about that individual module, from which lecturers teach on it, what the assessment type is. But if you scroll down to the bottom, you are able to see a potential reading list. So you can have a look at that. If you are really kind of hungry and thirsty for information, if you are just genuinely interested in the topic, then you can go through, have a look at the different modules that we offer, and have a look at the recommended reading list for each of those modules. And that, in addition to anything that Alex suggests, is perhaps a good starting point if you do have a particular area that you're interested in finding out more information about. We've got other questions here around some options to work within the NHS, or any health institutions after studying the programme. Again, I would definitely refer to our fantastic Swansea Employability Academy team, as well as our faculty employability team. We do offer that support, and the aim really of today's session is just to give you a little bit of an insight into the potential options that there are for you upon graduation from Swansea with the Health Informatics qualification. But certainly if you do hopefully join us, then that would be a great opportunity for you to engage with our employability services, to really get into the specifics of perhaps your individual circumstances, so that our great qualified advisors and team can help you then and find out what might be best for your particular circumstances. And his question, I suppose, around the dissertation part of the programme is, does the school provide for a research supervisor, or do students need to find those themselves?
Yeah, we provide the supervisor. You'll be allocated to a supervisor within the team, so it'll be somebody that's already teaching you. So that's something we do organise.
Fantastic. Thank you. Just checking if we do have any other questions. I can see that we've obviously gone through around the differences between health data science and health informatics. We've looked at potential areas of employability within the UK upon graduation, but of course there are obviously a lot more, and there are quite broad options as well, even from that. So this is hopefully just a starting point for you. This will, if you do have any questions, please do get in touch with us, because we'll be very happy to have those conversations with you. So I can't see any other open questions. If you have not been able to join us live, then please do make use of our contact details and ask any questions that you would like, whether that is subject specific or program specific. So thank you very much for taking the time to watch this, either live or as a recording. And of course, thank you so much, Alex, for taking the time to share your kind of experience and your knowledge of health informatics. I think that certainly opened my eyes into how many different areas there are available within health informatics. So really, really exciting, and I'm sure we are going to see exponential growth in the area in very, very short future. So thank you so much to Alex. Thank you to everyone. We hopefully look forward to seeing some of you in Swansea in September. Thanks very much, everyone. Bye-bye.